This is an introduction to digital dental photography, and we're going to go over the protocol that we use here in Stony Brook. Let's go over the armamentarium. We have our water bath here, which is used to defog our mirrors, cheek retractors, an occlusal mirror, and a buccal mirror. A buccal mirror can be useful to take angled photographs of the buccal segment when the patient's musculature doesn't allow us to do so. Let's go over how we defog our mirrors. A few different ways of doing that. If you have access to suction, you can use a saliva ejector. If you have access to an air-water syringe, you can use air. This is one way of doing it, where you use the mirror and you immerse it into the warm water for a few seconds. Then use a paper towel to wipe it, and this will prevent condensation or fogging. Another trick that we can use is to have the patient take a deep breath through their mouth and hold it for a few seconds. For the extraoral pictures, you need to be about 5 feet away from your subject, and you need to have a white background in order to have everything focused. So the first photograph is repose or at rest, no smile. The next one is smile, smile for me. And the other one is profile. Move to the side for me, shoulders facing the side, good. Great. Generally we use manual focus, and we do a test focus first. Smile for me. So when you do your fine focus, you can just control it by distance. Open. My recommendation is to try to use the larger end of the mirror, because it's going to retract the cheeks. And have your patient help you with this. Hold it with your thumb and forefinger at the tip right there. Turn towards me. The plane of occlusion is parallel to the floor. You might need to retract sometimes. So that's our maxillary occlusal. Okay. Now put your chin up for me. Open. So we want to tilt the head back for the mandibular. And I like stabilizing the mirror with the incisal edges of the maxillary teeth. Good. Okay, we're going to use these cheek retractors. Open. And hold these for me. Gently. Close down all the way. Good. Turn towards me. Put your chin down a little bit. Now you want to make sure that you crop, when you take the picture, you want to go close. You're not going to be able to see it here, but you want to do all your Photoshop in your mind's eye. Good. Now, turn your chin towards me. We're going to bring this more towards the middle. Bite down all the way. And we're going to pull this back like that. Turn towards me. Most of the time this will give you a good buckle photograph. Bite. And turn all the way to the side. Good. Turn to the other side. Again, we bring this cheek retractor to the middle and retract this. Good. Now, sometimes the cheek will not be able to retract all the way, in which case we can use a buckle mirror. Open. You use a retractor on one side. Hold this one. Bite down. Good. So you want to take the picture in the mirror, perpendicular to the mirror, like that. Let's do the same thing on the other side. Open. Close. Good. Turn towards me. I put it horizontally, retract, and then straighten it. Deep breath through your mouth. Good. So these are two ways of taking buckle photographs, whatever works best in your hands. When we're finished with the photography session, can't forget to disinfect the camera. Make sure you cover the lens and avoid using a surface disinfectant on the lens itself.